A great day to all of you. I'm Jessica PADAYHAG from BSEP 2B Science to have introduction for vitamin B6 or pyridoxine. We're about to discuss what is vitamin B6 and its functions, roles, and benefits to human health. Vitamin B6 or pyridoxine may not be familiar once we hear it. But for now, let's figure out what vitamin B6 really is and how does it affects our body. A vitamin B complex nutrient that the body requires in limited quantities to work and remain healthy. Vitamin B6 aids in the health of nerves and skin, the battle against diseases, the normalization of blood sugar levels, the development of red blood cells, and the proper functioning of certain enzymes. Vitamin B6 is made up of pyridoxine, pyridoxal, and pyridoxamine, which can be contained in cereals, beans, peas, nuts, meat, poultry, fish, eggs, and bananas. It is soluble in water or may dissolve in water. Mouth and tongue sores as well as nervous disorders may be caused by lack of vitamin B6. Vitamin B6 is being studied in the prevention of hand-foot syndrome, a condition characterized by discomfort, swelling, numbness, tingling, or redness of the hands or feet caused by some anti-cancer drugs. Pyridoxine is another name for this vitamin. It helps nerves impulses to move more quickly. Neurotransmitters are chemicals that are responsible for processing information in the nervous system, such as serotonin is the most well-known neurotransmitter. It aids in the synthesis of homocysteine, which is linked to cardiovascular disease and cognitive dysfunction at elevated levels. For in addition, let's talk about the roles of vitamin B6. Vitamin B6 is an essential nutrient for the nervous system and metabolism. Its functions include converting food into energy and assisting in the production of neurotransmitters, including serotonin and dopamine. B6 is one of the 8 B vitamins. This vitamin group is essential for proper cell function. Let's move forward to the benefits or the functions of vitamin B6. Here are 9 benefits or functions of vitamin B6. The first one is may improve mood and reduce symptoms of depression. Vitamin B6 deficiency has been related to depression in older adults. But research has yet to prove that B6 is an effective treatment for mood disorders. The second one is may promote brain health and reduce Alzheimer's risk. Vitamin B6 can help to prevent cognitive decline by lowering homocysteine levels, which have been linked to Alzheimer's disease and memory problems. However, no studies have shown that B6 is involved in improving brain health. The third one may prevent and treat anemia by aiding hemoglobin production. Vitamin B6 deficiency can cause low hemoglobin and anemia. So, supplementing with this vitamin can help avoid or treat these problems. The fourth one may be useful in treating symptoms of PMS. Due to its function in the production of neurotransmitters, high doses of vitamin B6 have been shown to be successful in reducing anxiety and other mood problems associated with PMS in some studies. The fifth one is may help treat nausea during pregnancy. Supplementing with vitamin B6 in doses of 30 to 75 mg per day has been shown to be an effective treatment for nausea and vomiting during pregnancy. The sixth one is may prevent clogged arteries and reduce heart disease risk. Vitamin B6 can aid in the reduction of high homocysteine levels, which can cause artery narrowing. This can reduce the risk of heart disease. The seventh one is may help prevent cancer. Some observational studies indicate a correlation between adequate dietary intake and vitamin B6 blood levels and a lower risk of certain cancers, but more research is required. The eighth one is may promote eye health and prevent eye diseases. Supplementing with vitamin B6 can lower your risk of age-related macular degeneration or AMD. Additionally, adequate B6 levels in the blood can help to prevent retinal problems. More study, however, is needed. Lastly, is may treat inflammation associated with rheumatoid arthritis. Vitamin B6 levels in the blood can be reduced as a result of the inflammation associated with rheumatoid arthritis. High-dose B6 supplementation can help correct deficiencies and reduce inflammation, but more research is required to confirm these findings. For reminder about vitamin B6, supplements containing too much vitamin B6 can damage nerves and extremities over time. If you're thinking of taking a B6 supplement, talk to your doctor about protection and dose.
Vitamin B6 source. Vitamin B6, or also known as pyridoxine, helps the body to use and store energy from protein and carbohydrates in food. The body forms hemoglobin, the substance in red blood cells that carries oxygen around the body. Good sources of vitamin B6. Vitamin B6 is found in a wide variety of foods including pork, poultry such as chicken or turkey, some fish, peanuts, soybeans, wheat germs, oats, bananas, milk, and some fortified breakfast cereals. The nutrients from this essential vitamin family are necessary for vital functions throughout our body. These functions include reducing stress as well as maintaining overall good health. Vitamin B6 is often lacking in the average American diet. It's available in supplement form, but we can also intake this with 15 foods. It's always best to taste in your vitamins through foods, which are milk, ricotta cheese, salmon, tuna, yellowfin and albacore, eggs, chicken liver, beef, carrots, spinach, sweet potato, green peas, bananas, chicken feet, cereals, and avocado. Vitamin B6 along with the other B vitamins help the body turn food into energy. On its own, vitamin B6 has many other uses that are important to maintaining a healthy body and developing a healthy brain. Vitamin B6 is so important it may help trigger the growth of the first living creatures on Earth. The fact that these vitamins are so important to our nutritional status, coupled with the fact that they are water soluble, they are naturally stored in our body too, and to any major extent make it quick. It's easy to run dry on life.
Good day, I am Rohannah Ortiguerra, and the topic that I am going to discuss is the specific deficiency of vitamin B6. Vitamin B6 deficiency is uncommon. Inadequate vitamin B6 status is usually associated with low concentrations of other B-complex vitamins such as vitamin B12 and folic acid. Vitamin B6 deficiency causes biochemical changes that become more obvious as the deficiency progresses. Vitamin B6 deficiency is associated with microcytic anemia. It is a condition in which the body's tissues and organs do not get enough oxygen. This lack of oxygen can happen because the body does not have enough red blood cells or because the red blood cells do not contain enough hemoglobin, which is a protein that transports oxygen in the blood. When there is a lack of hemoglobin in a red blood cell, the cell is becoming smaller in size and can carry less oxygen than usual. Another associated condition is the electroencephalographic abnormalities, meaning that there is a problem in an area of brain activity. Also, dermatitis with cheilosis, it is the condition where there is a scaling on the lips and cracks at the corner of the mouth. And the glossitis, it is the swollen of tongue. Depression and confusion, and weakened immune function. Those are the associated conditions with vitamin B6 deficiency. So, individual with borderline vitamin B6 concentrations or mild deficiency might have no deficiency signs or symptoms for months or even years. So, in infants, vitamin B6 deficiency causes irritability, abnormally acute hearing, and convulsive seizures. Moreover, end-stage renal diseases, chronic renal insufficiency, and other kidney diseases can cause vitamin B6 deficiency. In addition, vitamin B6 can result from malabsorption syndromes such as celiac disease. It is a serious autoimmune disease that occurs in genetically predisposed people where the ingestion of gluten leads to damage in the small intestine. Also, there is the Crohn's disease. It is a type of inflammatory bowel disease. It causes inflammation of your digestive tract, which can lead to abdominal pain, severe diarrhea, fatigue, weight loss, and malnutrition. And also, there is the ulcerative colitis. It is a long-term condition where the colon and rectum become inflamed. The colon is the large intestine, and the rectum is the end of the bowel where stool are stored. A small ulcer can develop on the colon's lining and can bleed and produce pus. Those conditions that I've mentioned are the conditions that a person might have when they do not have the right amount of vitamin B6. Well, having vitamin B6 deficiency isn't common because vitamin B6 is present in most foods. Remember to include foods that rich with vitamin B6 in your diet.
A number of factors will affect a person's daily requirement for vitamin B6 because it impacts several aspects of a person's metabolism. According to the ODS, a trusted source, the recommended dietary allowances or RDA for vitamin B6 are: at the age of 0 to 6 months, 0.1 mg both male and female; 7 to 12 months, 0.3 mg both male and female; 1 to 3 years old, 0.5 mg both male and female; 4 to 8 years old, 0 to 6 mg both male and female; 9 to 13 years old, 1.0 mg both male and female; 14 to 18 years old, 1.3 mg for male and 1.2 mg for female. At the age of 19 to 50 years old, 1.3 mg for both male and female. The age of 51 and above, 1.7 mg for male and 1.5 mg for female. During pregnancy, a woman should take 1.9 mg of vitamin B6. During lactation, 2.0 mg of vitamin B6.
573.6 degrees Celsius. And did you know that the word biotin came from the ancient Greek word biotos, which means life or sustenance? It is because biotin keeps our body healthy, such as our liver, skin, nails, and such. And it is also a crucial nutrient during pregnancy, as it is important for the embryonic growth.
Dermal abnormalities is biotin deficiency are due to impaired fatty acid metabolism. These include hair loss or alopecia and periorificial dermatitis, scaly red rash around the orifices. These are eyes, nose, and mouth, also called as biotin deficient face. The rash is similar to that of zinc deficiency.
Good day, I am Lamon. So, what are the sources of vitamin B7? Vitamin B7, also known as biotin, is found in a number of foods, though in small amounts. Here are the top 10 biotin-rich foods that can be source of vitamin B7. This includes, first, egg yolk. Eggs are full of B vitamins, protein, iron, and phosphorus. The yolk is an essential rich source of biotin. Second is legumes. Legumes like peas, beans, and lentils are high in protein, fiber, and numerous micronutrients. Some of the richest sources of biotin is this category are peanuts and soybeans. Third, nuts and seeds. Nuts and seeds are good source of fiber, unsaturated fat, and protein. Most also provide biotin, but the amount tends to vary by type. Fourth, liver. Certain organs meats, especially liver, are high in biotin. This makes sense biologically, as most of your body's biotin is stored in your liver. Fifth, sweet potatoes. Sweet potatoes are full of vitamins, minerals, fiber, and carotenoid antioxidants. They are also one of the best vegetable source of biotin. 6. Mushrooms. Mushrooms are nutrient-rich in fungi that offer several health benefits, including ample biotin. In fact, their high biotin content protects them from parasites and predators in the wild. 7. Bananas. Bananas are one of the most popular fruit worldwide. They are packed in fiber, carbs, and micronutrients like B vitamins, copper, and potassium. 8. Broccoli. Broccoli is one of the most nutrient-dense vegetables. It is full of fiber, calcium, and vitamin A and C. 9. Yeast. Both nutritional yeast and brewer's yeast provide biotin, but specific amount vary by brand. 10. Avocados. Avocados are best known as good source of folate and unsaturated fats, but they are also rich in biotin.
Needed amount of diet for vitamin B7 or biotin. Currently, there is no recommended dietary allowance for biotin, meaning there is no widely accepted recommended daily dose. Biotin is taken from the foods we eat by the microflora of the large intestine. Most people produce enough biotin through their digestive system to avoid the need for supplementation, meaning there is no essential minimum dose of biotin, only recommended doses. Because of this, biotin supplementation is usually only necessary if a person have been diagnosed with a biotin deficiency. However, it's common and safe to take the small daily dose of biotin to prevent the biotin deficiency and potentially promote hair health. The National Institute of Health recommends a biotin dose of 20 to 30 micrograms per day for teenagers and adults to prevent biotin deficiency. If a person has been diagnosed with a biotin deficiency, follow the treatment dose provided by the healthcare provider. Treatment doses of biotin can vary based on a person's age and the severity of their biotin deficiency. So, what's the maximum safe dose of biotin? According to the Mayo Clinic, there is no side effects have been reported for biotin in amounts of up to 10 milligrams per day. This is double the amount of biotin that include in our biotin gummy vitamins. According to the Office of Dietary Supplements, part of the National Institute of Health, they report that the studies of even higher doses of biotin, including studies of biotin at doses of 10 mg to 15 mg per day, have not produced any symptoms of toxicity. With this said, it's still important not to take too much biotin unless person have been prescribed biotin at a specific dose by the doctor to treat deficiency. Stick to the recommended dose provided by the biotin supplement.